Welcome to the Wellness Lab Digest, where we help you to absorb powerful, life-changing insights from top wellness experts with our daily, bite-sized wellness podcast summaries. Each episode is packed with distilled, powerful takeaways to boost your health and well-being. To support this podcast, please scroll down on whatever app you're listening on. Ratings and reviews are helpful. Even better, just send the show to a friend. Or check out our sponsors at the bottom of the page, or simply click the Support the Show link.
All right, let's dive into something a lot of you've been asking about.
Oh, yeah?
Biological dentistry.
Yeah?
You guys sent over a YouTube interview with Dr. Dominic Nishwitz. It's from that Shawn Stevenson channel.
Oh, cool. Cool.
And, well, you know, we're all interested in how oral health connects with the rest of our health, right?
Yeah.
But
Exactly.
biological dentistry kind of takes that to a whole other level.
Yeah, it really does seem to challenge what we even think of as teeth.
Yeah.
Like Dr. Nishwitz, he doesn't see them as just these things for chewing.
Right.
He calls them like these tiny organs.
Oh, wow.
And they're like super connected to our nervous system
Oh, interesting.
through the trigeminal nerve.
I've heard of that.
Yeah.
Here.
So they're really integrated with our bodies in a
Yeah.
way that most people don't realize.
That's a whole different way of looking at teeth. It's not just about, you know, like chewing your food.
Exactly.
It's like they're part of a bigger system, right?
Yeah, he even calls them an external hard drive for the brain.
Whoa, wait, hold on. Really? An external hard drive?
Yeah.
That is a powerful image.
Right.
I mean, it kind of makes sense when you think about how bad toothaches can be.
Yeah.
Like, it's not just some little pain, you know.
It's debilitating.
Yeah, it feels like your whole system is going haywire.
It's like a distress signal going straight to your brain.
Right, like it's saying, hey, something's wrong here, pay attention.
Exactly. And that connection really makes you wonder, like, if our teeth are so linked to our brains, could the problems in our mouths be affecting our overall health
Oh.
in ways that we haven't even fully realized yet?
Right, it's like a whole new frontier of health to explore.
Yeah, and Dr. Nishwitz, he brings up this crazy statistic.
Okay.
He says that tooth decay is like the #1 most common chronic disease
Really?
globally.
Wow.
Over 90% of people experience it.
90%.
Think about that.
That's insane, especially with all the advancements in dental care that we have.
Exactly. You'd think with all the fancy toothpastes and electric toothbrushes, we'd have this figured out by now.
Right, you'd think so. So what's the deal? Why are we still struggling with tooth decay?
Well, Dr. Nishwitz points to our modern lifestyle as a big factor,
Okay, that makes sense.
and something called epigenetics.
Epigenetics, that's how our environment and habits affect our genes, right?
Yeah, exactly. So basically, he's suggesting that our modern world, the way we eat, the things we're exposed to,
Yeah.
it's all changing the way our genes express themselves.
Making us more prone to problems like tooth decay.
It's pretty wild when you think about it.
So it's not just about genetics, it's like our environment is actually influencing how our genes work.
Yeah, and he brings up this fascinating dentist named Weston Price,
Okay.
who studied indigenous cultures and their diets way back in the day.
Oh, interesting.
I guess what he found?
What?
The communities who lived on traditional diets, they had perfectly spaced teeth.
No way. Like no crowding or anything?
None. Zero decay. And get this, they even had room for 2 sets of wisdom teeth.
2 sets? Are you serious? That's incredible.
I know, right? It makes you wonder what they were doing that we're not.
Seriously, like what's changed in our modern world that's messed up our teeth so much?
Right, and in total contrast, Price found that those exposed to processed foods had all the dental issues we see today.
The crowding, the decay, all of it.
Yep, the whole 9 yards.
So it's like our diet is literally shaping our mouths.
He suggests that our species might actually be evolving,
Whoa, hold on.
and our teeth are like a reflection of those changes.
That's a pretty mind-blowing concept, right?
Yeah.
Like our lifestyle choices could be influencing the evolution of our species.
It makes you wonder what other changes are happening that we haven't noticed yet.
Seriously. And it makes you think twice about what you put in your mouth.
Right. It's not just about how it tastes, it's about how it's affecting your whole body.
And your future generations, potentially.
Exactly.
Yeah.
And then it gets even more interesting when Dr. Nishwitz brings up a possible connection between root canals.
Oh, yeah. Root canals are a big topic in biological dentistry.
Right. And mental health.
Okay, what's the connection there?
He explains that when you have a root canal, you're basically left with a dead tooth in your jawbone.
Right.
And he believes that toxins from that dead tooth can travel through your nerves and lymphatic system,
Oh, wow.
affecting your entire body.
So it's not just a local issue, it's like a systemic thing.
Right, and he suggests that those toxins could be contributing to mental health conditions like depression and anxiety.
That's pretty concerning.
It is.
So it's almost like a two-way street, right? Like
Yeah.
if you're struggling with mental health, you might neglect your dental hygiene. And then conversely, poor dental health could actually be making your mental health worse.
That's the idea.
Wow. It's also interconnected.
It is, and this actually ties into the work of Dr. Dale Breakson, who's done a lot of research on Alzheimer's and dementia.
Oh, wow.
And guess what?
What?
He considers dental inflammation a risk factor for cognitive decline.
Really? So taking care of our teeth could actually help protect our brains as we age.
It's a possibility that's worth considering.
It's a little scary, but also empowering, you know?
Yeah, I totally get that.
Like it's another reason to prioritize our oral health.
Absolutely. And on that note, Dr. Nishwitz believes that certain types of cavities,
Okay.
specifically the ones in the enamel, those early stage ones, he says they're 100% reversible.
Wait, reversible cavities?
Yeah.
I thought once you got a cavity, that was it. You know, you needed a filling.
Well, conventional dentistry might tell you that, but Dr. Nishwitz has a different perspective.
So how does that even work? How can you reverse a cavity?
It's all about creating the right environment for your teeth to remineralize.
Remineralize, so like rebuild themselves.
Exactly.
That's amazing.
And he emphasizes nutrients like vitamin D3,
Okay.
K2, magnesium.
Interesting.
They all play a crucial role in that process.
So it's not just about ditching sugar.
Well, sugar definitely plays a role, but it's more about the bigger picture.
It's like the whole ecosystem of our mouths, right?
Exactly. The oral microbiome, the acidity levels, and any nutrient deficiencies we might have.
Right. It's about getting to the root of the problem, not just treating the symptoms.
Absolutely. And for overall diet, Dr. Nishwitz advocates for an 80-20 approach.
80-20, so like 80% healthy, whole foods.
Exactly. Leaving a little room for those less than ideal treats.
It makes sense.
It's about finding a balance that works for you.
So what about root canals? I'm curious to hear his take on that, since he wasn't a fan of leaving dead teeth in the mouth.
Yeah, he's definitely not on board with the conventional approach.
So what's the alternative?
Well, he doesn't go into specifics in this interview,
Okay.
but his whole philosophy revolves around prevention and supporting the oral microbiome.
Right. It's about working with the body's natural healing abilities.
Exactly. And speaking of the oral microbiome, he actually calls it the second largest and most diverse microbiome in our whole body.
Wow, really? I had no idea it was that important.
Yeah, it plays a huge role in our overall health, and it directly impacts our gut microbiome.
So what happens in our mouths doesn't stay in our mouths, so to speak.
Exactly. Every day, we're swallowing billions of bacteria from our mouths.
Billions.
Yeah,
That's a lot of bacteria.
it is, and they all end up in our gut, shaping the ecosystem there.
That's wild. So our oral health is literally impacting our gut health.
It's all connected. And that's why Dr. Nishwitz is so cautious about those harsh mouthwashes.
Yeah, the ones that claim to kill 99.9% of bacteria.
Exactly. He compares it to nuking a garden.
Oh, interesting analogy.
Yeah, you might get rid of some bad bugs.
But you're also wiping out the good ones that are essential for a healthy ecosystem.
Exactly. It's about creating balance, not just obliterating everything.
So what does he recommend instead of mouthwash?
He's a big advocate for oil pulling with coconut oil.
Oil pulling, that's swishing coconut oil around in your mouth, right?
Yep. It might sound a little strange.
Yeah, it's not something you typically hear from a dentist.
But he believes it's a gentler and more effective way to modulate the microbiome and promote detoxification.
So how do you do it? Just swish any coconut oil.
He recommends using extra virgin coconut oil,
Okay.
about a teaspoon, and swishing it for 5 to 15 minutes.
5 to 15 minutes. That's a long time.
It is, but apparently it's worth it.
And then you just spit it out.
Yep, spit it out and rinse your mouth well.
Interesting. I might have to try that.
It's definitely a different approach.
Yeah, but it's all about working with the body, not against it.
Right. And I think that's a key principle of biological dentistry in general.
Yeah, it's about understanding the interconnectedness of our bodies and finding ways to support our natural healing abilities.
Exactly.
This is fascinating stuff. I'm already learning so much.
Me too.
And we're just getting started.
I know, right?
There's so much more to explore in the world of biological dentistry.
There really is.
And we'll be back to dive even deeper after a quick break.
Sounds good. Welcome back.
Okay, so before the break,
Yeah.
we were talking about Dr. Nishwitz's view of biological dentistry as like an upgrade
Mm-hmm.
from just fixing problems to a more holistic approach.
Right. He's all about prevention
Yeah.
and supporting the body's natural healing abilities.
Exactly.
You know, one thing that really struck me was his perspective on traditional cultures.
Oh, yeah. What about them?
He poses this question. If those cultures didn't even need dentists, what does that tell us about our body's potential
Okay, yeah.
to heal and maintain healthy teeth?
With the right knowledge and practices, right?
Exactly.
That's a really interesting point.
It is.
I mean, it makes you think about all the assumptions we have about dental health.
But
Like, we just assume cavities and problems are inevitable.
like we've been conditioned to accept a certain level of decay.
Right. Like, it's normal to have fillings and root canals.
Exactly.
And Dr. Nishwitz is challenging that whole paradigm.
He's saying, hold on, maybe there's another way.
We don't have to just accept these problems as part of life.
Right. We have more power than we think when it comes to our oral health.
That's empowering.
It is.
And it brings us back to those metal fillings, you know, the ones he called antennas, amplifying our exposure to EMFs.
Right.
That sounded a bit out there to me, to be honest.
I know. It's not exactly mainstream thinking.
But there is a lot of talk about the effects of EMFs these days.
Yeah, more and more research is coming out about it.
I mean, we're surrounded by EMFs all the time.
Our phones, Wi-Fi, all kinds of devices.
And now 5G is rolling out everywhere.
Exactly.
So it's something we should be paying attention to.
Absolutely.
And Dr. Nishwitz is saying those metal fillings could be adding to our exposure.
That's his concern.
So should we all be running out to get our metal fillings removed?
Well, it's not a simple answer.
Right.
It's about informed decision-making.
Okay.
Remember, he emphasized finding a qualified professional, someone who understands the proper protocols for safe removal.
Right. Safety first.
Exactly. You don't want to just go to any dentist and have him yanked out.
No, definitely not.
It's a delicate procedure.
So it's about weighing the potential benefits against the risks.
Right.
Based on your individual circumstances.
Exactly. There's no one-size-fits-all answer.
And that highlights the importance of finding a dentist who aligns with your values.
Yeah.
Someone you trust, who will listen to your concerns.
Absolutely. It's about finding a partner in your healthcare journey.
And speaking of resources, Dr. Nishwitz mentioned a couple of places where our listeners can find more information.
Yes, he encouraged people to follow him on Instagram.
Oh, what's his handle?
@Drogum1.
Okay, @Drodum1.
And for dentists interested in learning more about his approach,
Yeah.
he mentioned the Institute of Biological Dentistry.
Oh, cool. I'll have to check that out.
It's a great resource.
It's exciting to see this movement gaining momentum.
It is. More and more dentists are embracing this holistic approach.
It feels like a real shift is happening in dental care.
Yeah, it's about time.
I think this conversation has really inspired our listeners to think differently about their oral health.
I hope so.
To be more proactive, to question things, to advocate for themselves.
It's your mouth, your health, your choice.
Exactly. And I think we've only scratched the surface.
Oh, yeah. We've just touched on a few key points.
There's so much more to learn and explore in the world of biological dentistry.
Absolutely. And I think it's important to remember that we're constantly learning and evolving.
Right.
There are always new discoveries and approaches to explore.
When it comes to our health.
Exactly. And sometimes the most profound insights come from challenging the status quo.
Like Dr. Nishwitz is doing.
Exactly. He's not afraid to question conventional wisdom.
And look beyond the mainstream.
And that's what leads to real progress.
It makes you wonder what other hidden connections and potential solutions are out there just waiting to be uncovered.
It's exciting, isn't it?
It is. It's a bit mind-boggling to think about all the possibilities.
It is. And that leads us to a final thought-provoking question for our listeners.
Okay, hit me with it.
If we can reverse cavities and regenerate our teeth naturally, what other seemingly irreversible health conditions might we be able to address
Ooh, that's a good one.
with the right knowledge and interventions?
Wow, that's a powerful question.
It is. It really opens up a whole new world of possibilities.
It's a reminder that the human body has an incredible capacity for healing and regeneration, and that we shouldn't underestimate its power.
Exactly.
Well, I think we've given our listeners a lot to chew on in this deep dive.
I agree.
And I'm sure they're eager to hear more.
I'm ready to keep exploring.
Me too. So let's take another break.
Okay.
And come back for the final part of our exploration into biological dentistry. Okay, we're back, and I'm still thinking about all those connections we were talking about.
Oh, yeah.
Like how our oral health can impact our whole system.
It's wild, right?
It is, especially that link between the oral microbiome and the gut microbiome.
Yeah, that's not something you hear every day.
No, not at all.
It makes you realize how much more there is to oral health than we think.
Exactly. And it makes those probiotic yogurt commercials suddenly make a lot more sense.
All right, like we're literally swallowing billions of bacteria from our mouths every day.
Billions. It's kind of gross when you think about it.
It is, but it's also fascinating.
Yeah, I guess so.
It highlights the importance of balance,
Right, not just wiping out all bacteria like those harsh mouthwashes do.
Exactly. And that brings us back to oil pulling.
Oh, yeah, coconut oil swishing.
It still sounds a little weird to me.
I know, right?
But I'm willing to try anything that's natural and gentle.
Me too.
It's worth a shot.
Rarely.
And hey, if it's been around for centuries in traditional medicine, there must be something to it.
You've got a point.
It's all about working with the body's natural processes.
And Dr. Nishwitz has seen some pretty amazing results with his patients.
Oh, yeah. Like what?
He talked about people who experienced relief from all sorts of things. Depression, anxiety, even chronic pain.
Really? Just from addressing their dental issues?
That's what he said.
Wow, that's incredible.
And some people even saw improvements in their skin and weight.
It really makes you realize how interconnected everything is.
Totally. Like our mouths are a window into our overall health.
And by taking care of our oral health, we're potentially taking care of our whole bodies.
It's a powerful concept.
It is. And I think it's a message of hope and empowerment.
Yeah, it's definitely empowering.
We have more control over our health than we think.
So where do we go from here?
Well, if you're interested in learning more, Dr. Nishwitz's Instagram is a great resource.
Right, at Dardum1.
And for dentists out there who want to dive deeper into this approach, there's the Institute of Biological Dentistry.
Awesome. I'll be sure to include links to all of that in the show notes.
Perfect.
Well, this has been an incredible deep dive into biological dentistry.
I agree. It's been eye-opening.
It's definitely changed my perspective on oral health. And I hope it's inspired our listeners to take a more proactive approach to their dental care.
Absolutely.
Remember, your oral health is a reflection of your overall health.
So take good care of your smile.
It's the only one you've got.
And never underestimate the power of your body to heal.
That's a great message to end on.
It is.
Thanks for joining us on this journey into the world of biological dentistry.
It's been a pleasure.
And we'll be back soon with another fascinating topic to explore.
Sounds good.
Until then, keep learning, keep questioning, and keep taking good care of yourselves.
Thank you for listening to the Wellness Lab Digest. If you received value from the podcast, I have 3 asks of you. 1, share the show on social media with your friends and tag the show at the Wellness Lab Digest on Instagram. Number 2, please leave a rating and review in whatever app you're listening on. And last but not least, please let me know what topics you would like us to cover in the future. You can contact me at empoweringmen.org/contact. And right now we have a free ebook to get you started on your wellness journey as well. That's empoweringmen.org/contact. To support this podcast, check out our sponsors at the bottom of the page or simply click the Support the Show link.